Hi, I'm Jocelyn, and today my speech is going to talk about the important steps it is taken in order to check glucose levels in diabetes patients. Diabetes is an overwhelming epidemic in the United States that we are facing at this very moment. Many, if not all of us, know someone in our lives who is currently facing the struggles of this disease or currently has it themselves. Maintaining glucose levels in the body is very important in maintaining this type of disease. If there are any caregivers, spouses, parents out in the audience who are taking care of somebody with diabetes, then you know how important it is to check their glucose levels and making sure that they are maintained. Or, on the other hand, if not a caregiver, then someone out there who is new to the diabetes world, whether you need a refresher on how to take your glucose levels, or if you are currently dealing with diabetes yourself, this one is for you. My credibility with sharing this information comes from personal experience of taking care of my grandpa, who currently has type 2 diabetes. I can tell you this was one of the most important things that I did have to learn in order to help him take care of his glucose because it's something so important that has to be maintained. Using the proper technique and steps is crucial in getting a proper reading for a glucose and being able to monitor glucose levels in whoever you be caring for or for yourself is very, very, very important. My goal today from this speech is to teach you these steps you need on how to take a glucose reading efficiently and properly. According to the American Diabetes Association, these steps are what you're going to need to take in order to get a proper, accurate glucose reading. So, here I wanted to share my screen. Here we go. So, first things first, let's go over instruments that you will need to take a glucose. First, you will need a blood sugar meter. You will need a disposable testing strip, a pricking needle or a lancet that should come with your testing kit, an alcohol prep pad, and a band-aid. Very, very, very first and foremost, before you even do anything or touch any needle or lancet or blood sugar meter, testing strip, anything, is making sure to wash your hands with soap and water effectively, efficiently for 20 seconds. This helps to prevent any infections, spread germs to the open little spot, to the patient, to you, to anyone. It just helps. Also, if you have it on hand, you can also use gloves as well, but washing your hands is just perfectly fine as well. Okay, preparation phase. So in this phase, you want to pick a finger that you're going to use. Most commonly, it is the middle finger, and it is like the first knuckle of your middle finger that you typically would use. And what you're going to want to do is you're going to want to prep that area, and you're going to want to wipe it down with an alcohol pad. Make sure it's nice and clean and it's disinfected, getting ready for that lancet or that needle. You also want to allow the alcohol to dry before you prick the needle because sometimes if the alcohol isn't dry when you go and prick, it can sting just a tiny bit. And while you're waiting for the alcohol to dry, you can go ahead and insert the test strip as seen here into that blood sugar meter, and you can go ahead and set that aside, just have it prepped and ready to go. Next, we are actually going to take the glucose. So before pricking with the needle, you want to give the patient, person, anybody a fair warning about what's going on. Kind of just explain this is what I'm doing before actually doing anything. Helps with the fear, helps with any surprises because those are not fun. So you want to grab the patient's finger or your own finger and you want to grab it firmly but not painfully. You want to make sure you have a good grip on it before going in and pricking them. Also, before you prick, you want to go ahead and massage some blood up into the patient's first knuckle. Just go ahead, just kind of like this. You want to just kind of move that blood up into that first knuckle there. Next, once you've done that, you're going to go ahead, grab your patient's finger, give them that fair warning. About to prick your finger, give them a 1, 2, 3 if they'd like it. You're going to go ahead and you're going to prick their finger. Once that blood comes to the surface, you want to go ahead and just wipe away that first drop with an alcohol pad, and you want to gently squeeze that finger and get a new little dot of blood that you're going to use and get that to the surface. Then, once you have that, you're going to take your testing strip on your glucose meter and you're going to place it right onto that blood, gather that blood in that glucose meter, and you're going to wait for your levels to come back. So you can go ahead and set that aside while you're waiting for your levels to come back. While you're waiting for those levels to come back, what you can go ahead and do is we're going to do our little cleanup. So what we're going to do is you're going to wipe their finger with that alcohol pad. Make sure there's no blood anywhere. Just wipe it up, get it nice and clean, disinfect that area again. Next, you want to go, once that's dry a little bit, let it dry. Go ahead and put a band-aid if they would like it. If not, no worries. You can just hold pressure there for a minute and the bleeding will stop. And then once our blood sugar results come back, it will be now time to decide what the next course of treatment would be. If the blood sugar is too high, you have to know how to bring it down. If it's too low, you know how to have to bring it back up. So either the next steps could be doing insulin, it could be eating some candy, drinking some sugary drinks, drinking some juice. Just making sure we know what the next steps are, if it's too high or if it's too low. Also, another good option for tracking, if this is something that the patient is interested in, if the doctors recommend it, is going ahead and actually physically writing down what the glucose level blood sugar was, just to keep track the date, the time, and what it was. Just another little thing to keep track of those glucose levels. So in conclusion, to conclude, you want to be able to take a glucose level reading because it can play an important role in either your own health or in someone else's health that you are taking care of someone you love. And being able to take a glucose properly and efficiently and effectively can really help to be able to properly take care of a patient or for yourself. And just being able to manage that diabetes, an extra person doesn't help in that support system. Together, diabetes can be managed and it can be a less scary disease when more people are aware of the smallest things that can help. So even just taking a blood glucose for your patient, or even knowing if their blood sugar is too high, giving them insulin, or if it's too low, bringing that back up with something sugary. Just small little supports like that can really make a big difference, and especially for the patient. And also knowing how to take a glucose level, it's one of those things that you never know when you may need it, but it's also just another step in the support system journey. And that is how to take a glucose.